We have Miss Joana, nicknamed Joe's Mott from Water for Women. Joe's has over 25 years experience in international development and community development roles, working in a range of country contexts, mostly in the GWSC and WASH sectors. Through her work, she has come to understand the importance of having and maintaining a focus on supporting menstrual health and equity in all development programs. Without a strong and intentional focus on this, the health, resilience, and well-being of people who menstruate or will menstruate, that is over half the global population, cannot be fully realized. Most recently, for the last 7 years, Ms. Jose was the GWSC advisor on the fund coordinator team for the Australian government's Water for Women Fund. Her leadership links menstrual health to climate resilience. Ms. Jose, the virtual stage is yours.
Thank you so much, Vanita, and warm hello to participants and panelists alike. It's great to be here today. Sorry, I'm going to ask you, Vanita, if you wouldn't mind sharing your screen. I'm just having a lot of trouble with my laptop, if that's okay. And I'll just say when to go to the next slide. Thank you. Yeah, so I'm honoured to be here today to talk on behalf of Water for Women and about how we're collectively working towards a more period-friendly world, but also how we need to really accelerate action urgently at all levels to make this happen. So in my presentation, I'd like to focus on the learnings from Water for Women and the learning brief, which Vanita mentioned just before, which was published towards the end of last year. And through doing so, I hope to answer the question that was put before me about transformative approaches to meaningfully embed menstrual health in WASH programs and systems to achieve lasting social impact. So yes, next slide, please. So, but before I do, just for those who might not be familiar with Water for Women, just a very quick overview. Water for Women is coming to a close at the end of this month after 7.5 years in operation. And it's an Australian government-funded program with its primary goals supporting improved health, gender equality and well-being in Asian and Pacific communities through climate resilient, socially inclusive WASH projects. Next slide, thanks. So just a quick snapshot. Through that time, we've reached close to 160 million people across 16 countries in South Asia, Southeast Asia, and the Pacific. And it's involved working with 10 civil society organisations and 5 research organisations, which all have in the 16 countries, which all have worked with in-country partners, including government, private sector, research organisations, rights holder organisations, and civil society organisations. And just to note that the second phase, i.e. the last 2 years, has been focused specifically on climate resilient WASH, i.e. exploring the connections between climate resilience, inclusion, and WASH. Next slide, thanks. So now to the learning brief. So this learning brief was co-authored by ID Global and Sagana and Water for Women. And it draws on the experiences and learnings from Water for Women partners in implementing menstrual health in their WASH projects. And these findings, some of the key findings mentioned here, reflect the insights from partners who attended some menstrual health workshops that Sagana facilitated last year. So we can see here that, I think this comes as no surprise in terms of the key issues that are hindering menstrual health equity globally. We had our previous presenters have been talking about this, the lack of awareness, poor product access, inadequate facilities, WASH facilities, and lack of options for safe disposal and harmful gender norms all impact on menstrual health and equity. And then we're starting to understand, how climate change really exacerbates menstrual health challenges through too much water, which Aranima highlighted in terms of the work that ID has been doing, in terms of the houses on stilts and, the flooding that comes up. So it's a really good example. And too little water or too dirty water. And there are also further climate change challenges, which are around, supply chain disruptions and damage to infrastructure, which impact heavily on menstrual health. And we know that improved wash access is crucial for menstrual health, but so too are cross-sectoral collaborations and a stronger systems approach, which are really needed to resolve underlying problems and ensure more holistic interventions across the board. And we're also starting to talk about more about the importance of linking menstrual health to climate resilience, because this is a way of potentially unlocking climate finance for WASH initiatives and improving menstrual health outcomes at the same time. Next slide, please. And perhaps an obvious, but sometimes not so obvious point that is made through the learning brief is how menstrual health is investing in community resilience. So I think and you were talking about that before, the well-being and health and resilience of those who menstruate, people who menstruate, but how that impacts really on community resilience, and then also how community resilience really is integral to climate resilience in the long term, because if a significant proportion of the community is unable to participate because of stigma and social barriers, and also because of their health and well-being and resilience being affected by poor menstrual health, then how can they be involved in building community resilience solutions with the rest of the community? It makes it so much harder. So the link is there. Next slide, thanks. So there are a number of challenges, as you can see, that Water for Women partners identified, and these were categorised into 3 levels: structural, thematic, and program. And, with the structural, again, that is a really important point that Ina was making around, the lack of political prioritisation because of not being reflected in the SDG targets. And this, is linked to that structural level of how, the lack of menstrual health policies, resourcing and budget allocation. Then on the thematic level, the strong pervasiveness of menstrual taboos and myths and stigma, which has already been discussed by the other panelists, and really how this serves to contribute to a kind of a code of silence and invisibilisation of the topic, and also how this contributes to how the perception that access to sanitary pads is not really understood as a basic need and right. We're still working on that. And then the program level is really, the issues around for WASH actors and the WASH sector, around the timing and sequencing for menstrual health integration, and, how to really go about tackling some of the underlying drivers of menstrual inequity. And then there's kind of perceived competing priorities around when in the field, when you're looking at menstrual health, WASH, and climate interventions. So these were all, and in short time frames. So these were all kind of identified as challenges. Next slide, please. But so what has worked? And from Water for Women partners, what do they feel that they've done that has really worked from their perspectives? And 5 key strategies were drawn out. There were some others, but these are the key ones. But the first being engaging men and boys at community and institutional levels to be champions and allies. And we talk about this, engaging them in the right ways and in the right spaces. the second, researching and supporting greater product choice, of which ID Cambodia has been very strong in this regard. And so looking at, disposable, biodegradable, or reusable. And we know that this choice depends on such a wide number of factors, including supply chains, infrastructure, and disposal mechanisms, as well as cultural norms and behaviour change. And contextualizing menstrual health messages. This is critical. And yes, again, Aranima highlighted that really well around the sales agents, a really good example of that. And it's really dependent on, diverse audiences. So whether focusing on men, women, girls, gender diverse people, people with disabilities, at the institutional level, at the community level. So contextualization is super important. The other one being around moving beyond just periods, so i.e. just bleeding days, and having a more holistic approach to menstrual health in terms of life cycle stages, but also in terms of sexual and reproductive health. And last, increasing the focus around menstrual waste disposal on both at the personal level, but also at the environmental level, because that's really important to start advocating for and influencing for change with government partners. Next slide, please. Okay, so based on these learnings, what needs to be urgently accelerated for turning a period-friendly and responsive world into a reality? So we've come up with 9 interlinking call to action points. So firstly, the inclusion of menstrual health in policies and financing plans, including climate. And really, secondly, investing in menstrual-friendly wash infrastructure is obviously critical. Also encouraging design of wash facilities and products that cater to diverse groups, including for people with disabilities. System strengthening, so really supporting inclusive governance mechanisms which improve access to appropriate products and safe disposal. The focus on shifting harmful norms really needs to continue and ramp up, because it's really it is a blocker for so many other aspects that are mentioned here. And the next being around improving availability and access to accessible information about menstruation for diverse groups. So, really being able to support that accessibility for underrepresented groups in the community is really important. The seventh, integrating menstrual health considerations into disaster preparedness and response plans. And 8, investing in monitoring, learning and research, really, really important and critical for evidence-based policy planning and implementation. And we can really only achieve all these actions if we commit to effective multi-stakeholder approaches that strengthen collaboration and dialogue across sectors, across organisations and across levels to bring about locally led solutions that not only are started but sustained. Next slide, please. So for me, if we're talking about transformative change, if we can systematically work on those actions that I just talked about, there will be much more of this that we will see across our institutions, workplaces and communities. And the last slide, if you're interested in delving more deeply into the learning brief, you can access it by this